Is doing more training always better? Or is there a point at which too much training can inhibit muscle growth, or even worse, cause muscle loss? In this video, we will explore what overtraining is, what causes overtraining, and how it applies to muscle growth via resistance training. To answer these questions, we first need to understand what exactly overtraining means. Well, this is a challenge in itself because there is no real consensus as to what overtraining truly refers to, and if it even exists. To start, let's explore the theoretical concept of overtraining and how it manifests. Essentially, there are thought to be three levels to the overtraining spectrum. First is functional overreaching. This is basically just short-term overtraining, only lasting a few days up to around 2 weeks. Athletes would experience a decrease in performance during this time, but once overall training load is decreased, it is thought that this will result in a supercompensation of performance. This is basically how athletes attempt to peak for a competition. Second, we have non-functional overreaching. This refers to a decrease in performance lasting around 2 weeks and up to 2 months. Because of the prolonged decrease in performance, once overall training load is reduced, performance only comes back to baseline. There is no supercompensation effect. And lastly, we have what is known as overtraining syndrome. This refers to a chronic decrease in performance which lasts longer than around 2 months. And even when reducing training load, performance may not return to baseline for multiple months later, or potentially never at all. So what happens when we enter either of these states of overtraining? Well, the primary definition of overtraining is that it results in a decrease in performance. Usually this is classified via actual performance outcomes, not muscle growth, but this is something we will discuss later in this video. In addition to a decrease in performance, athletes may experience other symptoms too. Generally, this is accompanied by elevated perceptions of fatigue, poor sleep, a decreased motivation to train, poorer mood states such as increased irritability and restlessness, and possibly even more severe mental health consequences such as increased depressive symptoms and anxiety. Like we mentioned, the concept of overtraining is quite vague and not very well established, and there haven't actually been all that many cases of overtraining reported in research. According to this research review, there have been a total of 328 reported cases of potential overtraining in the literature to date. And if we look at this table, we can see that most cases are reported from endurance type exercise such as running, rowing, swimming, and triathlon. And in terms of resistance training, there have only been 8 reported potential cases of overtraining to date. So far, we have been discussing the prevalence of overtraining in athletes. However, what we really want to know is if overtraining can affect muscle growth. Is it possible to train so much that muscle growth is inhibited or even results in muscle loss? Let's look at a few different variables to see whether excessive training can cause a reduction in muscle growth. First, let's look at proximity to failure. In other words, how close to failure we take each set. There are many studies looking at the effects of proximity to failure on muscle growth, and most studies find that training to failure tends to have a neutral to positive effect on muscle growth compared with leaving a few reps in reserve. This meta-analysis compiled and analysed the evidence comparing training to failure versus not to failure. The overall body of evidence suggests that training to failure seems to be slightly superior compared with non-failure training, as shown by this diamond being towards the right-hand side of the midline. So it seems that training to failure isn't really something that will inhibit muscle growth. If anything, it seems to result in superior growth compared with not training to failure. So it doesn't seem that training to failure is something that promotes overtraining, at least not in isolation. Although, just to be clear, this doesn't necessarily mean that you should always train to failure in all cases. It just tells us that training closer to failure probably isn't going to inhibit muscle growth. The next variable we can look at is volume. This refers to how many total sets we train each muscle group with per week. So, does performing more volume inhibit muscle growth? Well, the evidence also tends to find that performing more volume seems to be neutral to positive for muscle growth, even up to very high volumes. For example, this study explored the effects of different training volumes on muscle growth. Trainees performed the same training routine with a different number of sets. One group trained with a total of 16 sets per major muscle group per week, another group with 24, and the last group with 32 sets. And as we can see, more volume resulted in superior growth for all muscles measured, even when training each muscle with 32 sets per week. So once again, it doesn't seem like increasing volume inhibits muscle growth either. And if anything, it is likely to result in a faster rate of muscle growth over time. So we probably can't say that volume is a variable which causes overtraining in isolation. Again, this doesn't mean you should just do the highest amount of volume possible. There are other factors to consider too. It just tells us that increasing volume probably won't inhibit muscle growth either. Next, let's discuss frequency. Here we are referring to how many times we train each muscle group per week. It is often recommended that you don't want to train a muscle on consecutive days to provide enough time for muscle recovery. However, this doesn't seem to fully align with the evidence we have. Usually we find that higher frequency training tends to result in similar or even superior growth compared with performing the same amount of weekly volume with a lower frequency. For example, this study explored the effects of moderate versus high frequency training. Trainees performed the following training routine consisting of the same exercises, rep ranges, and total weekly sets. However, one group trained each muscle 3 times per week with more sets each session, while the other group trained each muscle 6 times per week with fewer sets each session, meaning each muscle was trained on 6 consecutive days each week. It was found that muscle growth was similar between groups for all muscles measured apart from the biceps, which actually saw decreases in muscle thickness in the high frequency group for some reason. It is possible that this was due to overtraining as a result of the high frequency training, but I wouldn't think so because all other muscles saw significant growth with the high frequency training too. So I would think this may be due to random chance or possibly a measurement or statistical error. So ignoring the biceps finding, this study suggests that training a muscle with a high frequency probably isn't going to inhibit muscle growth either. This doesn't mean that you should train every muscle every day, it just tells us that you aren't going to overtrain if you train a muscle on back-to-back days. And the last potential variable worth exploring is load. In other words, how heavy we lift. We generally find that muscle growth can be equally achieved across a large spectrum of rep ranges and loads. Training anywhere between around 5 to 30 reps seems to produce similar muscle growth on a per set basis, provided we are taking each set close to failure. Although training too heavy does seem to be less effective for muscle growth. This was seen in this study, which explored the effects of moderate versus heavy loads on muscle growth. Trainees performed 3 sets of the following exercises 3 times per week for 8 weeks. Half the subjects trained in the 2 to 4 rep range, meaning a heavier load was used, while the other group trained in the 8 to 12 rep range, meaning a lighter load was used. It was found that both groups experienced notable muscle growth, although the moderate loads produced more muscle growth of all muscles measured, shown in the orange. So it seems that if we train too heavy, we may be limiting muscle growth to some extent. However, I wouldn't say this is due to overtraining. This is because, firstly, we still see muscle growth occurring with these heavy loads. There isn't a decrease in the adaptation we are after. Also, this study found that strength gains were actually superior when training with the heavy loads. As we can see, bench press and back squat 1RM strength was greater after lifting with heavy loads, shown in the blue bars. So performance was actually greater, just the morphological adaptations, i.e. muscle growth, was superior with moderate loads. And also, training with heavy loads in isolation doesn't seem to cause some of the other symptoms present with overtraining, such as altered mood states or sleep issues. So while lifting too heavy might not be best for muscle growth, it probably isn't causative of overtraining in isolation. So if none of these discussed variables are directly causative of overtraining, what could be the cause? And more importantly, is there even such thing as overtraining in the context of muscle growth? Well, there are a few potential ways that overtraining could manifest and limit muscle growth. The first is psychological fatigue. There are many different forms of psychological fatigue that can have negative effects on lifting performance and potentially long-term muscle growth. It has been shown that mental fatigue can inhibit lifting performance acutely. For example, this study explored the effects of mental fatigue on lifting performance of a resistance training session. On 2 separate occasions, subjects performed 3 sets of back squats to failure at 70% 1RM. Before each session, subjects either watched a 30-minute nature documentary as the low mental fatigue condition, or performed a demanding cognitive task for 30 minutes, which was the high fatigue condition. After each condition, subjects reported higher perceived mental fatigue after the cognitive task compared with watching the documentary, although perceived motivation to lift was similar. And this mental fatigue had a small impact on lifting performance. As we can see, the cognitive task resulted in trainees performing less total volume load across the 3 sets, shown in the orange, compared with the control condition, shown in the blue. Furthermore, psychological fatigue can also inhibit training adaptations from a long-term perspective. This meta-analysis explored the effects of sport specialization on psychological status in adolescent athletes. Based on the body of evidence, those who specialized in a single sport reported higher levels of exhaustion, reduced sense of accomplishment, and sport devaluation, compared with those involved in multiple sports. While this research isn't entirely relevant to those interested in muscle growth via resistance training, it does tell us that being hyper-focused on one specific goal probably increases our risk of mental burnout. So overall, psychological fatigue can certainly be detrimental to resistance training from both an acute and chronic perspective. This may be one contributing factor to the phenomenon we call overtraining. Another potential form of overtraining that can be present is through joint stress. This refers to stress experienced by the joints and connective tissue during resistance training. And excessive joint stress can result in pain, irritation, or injury to those specific regions. It is certainly possible that some of the variables we discussed earlier can impact joint stress, although it is difficult to pinpoint any specific variables which are predictive of injury. Rather, it seems that sudden changes in any specific variables seems to be more predictive. This was found in this systematic review, which compiled the research on the association between acute to chronic workload ratios and injury rates in team sports. It was found that a higher acute to chronic workload ratio was associated with a greater risk of sustaining an injury. What this means is that if you suddenly perform a much higher workload than you are currently used to, you appear to have an elevated risk of injury. Instead, it is preferable to gradually change workloads over a series of weeks to allow the tissues to adapt to the new stress. In relation to resistance training, this means we don't want to make major changes to our routine in a short-term time frame. We don't want to suddenly increase volume too high or lift heavy with all sets of all exercises. It is certainly possible to tolerate high workloads, but it usually requires a more gradual increase over time. And if we do make major changes to our workload suddenly and develop pain or injury in a certain joint, I guess this could be considered a form of overtraining, because the demands of the exercise were too much for the tissues to handle. And the last potential form of overtraining relevant to resistance training is what we typically refer to as systemic fatigue. Excessive systemic fatigue is basically what lifters would think of overtraining as. It is most common for lifters to report excessive systemic fatigue occurring as a result of high volumes of heavy lifting with compound barbell lifts. Reported symptoms of excessive systemic fatigue often include reductions in lifting performance, a decreased motivation to train, disrupted sleep, increased tiredness, etc. Basically the same symptoms as overtraining. Although it is questionable as to whether this is truly physiological or if it is more psychological or if it even exists at all. This study questions this idea, which explored the effects of daily 1-rep max training on squat strength. 2 competitive powerlifters and 1 competitive weightlifter performed a 1RM squat plus 5 sets of 2 to 3 reps at 85 to 90% of their daily max they hit each day for 36 consecutive days. It was found that all 3 lifters increased their 1RM squat over the course of the study. The first lifter saw a peak increase in their squat 1RM of 5 kilos. Lifter 2 saw a 12.5 kilo increase, and the third lifter gained 13.5 kilos on their squat max. So by definition, these athletes were not overtrained, since they saw consistent performance gains over the course of the study. We don't know about their emotional state, joint health, or motivation to train, but the fact is they still got stronger. So it is once again unclear if the concept of systemic fatigue during resistance training is due to physiological mechanisms or if it is more psychological. So what does all of this mean when it comes to lifting in the gym? Well, firstly, we don't even have a great understanding of overtraining as a concept in general, and most reported cases are in endurance or multi-sport athletes as opposed to resistance training. Furthermore, the definition of overtraining in athletes doesn't really apply to muscle growth either. Overtraining is defined as a decrease in performance, but the goal for hypertrophy training is not performance related. It is a structural adaptation. Furthermore, there isn't really any clear variable which seems to be causative of a decrease in muscle growth in lifters. Although there are a few potential concepts which could be considered a form of overtraining relevant for hypertrophy training. First is that it is possible to experience reduced lifting performance and potentially inhibited long-term muscle growth resulting from psychological fatigue. This can have both short and long-term decrements in both performance and adherence to training. Furthermore, it is certainly possible to cause pain or injury by training with too much volume or intensity, although this is more likely to occur due to a large sudden change in variables as opposed to chronic exposure to a type of stress. And lastly, the concept of excessive systemic fatigue is also a potential type of overtraining sometimes reported in lifters, although this once again isn't really something that is well established. So in most cases, lifters probably shouldn't be worried about overtraining blunting muscle growth. Chances are that your body will simply adapt to whatever training you put it through. Although it is more of a possibility in lifters who also perform other sports or exercise, especially if they are endurance activities. Furthermore, just be sure to make gradual changes to your training routine as opposed to sudden changes. Thanks for watching, and hopefully you got something out of this video. Check out flowhighperformance.com for online coaching, training templates, ebooks, and more.